Before we dive in, just a quick but important disclaimer. The content in this briefing is for educational and entertainment purposes only. It is not financial, investment, or tax advice. So please always do your own research and consult with a licensed professional. All right, let's get right into it. We're in the first quarter of 2026, and the healthcare and biopharma sectors have hit a major inflection point. This isn't just another year of small changes. We are talking about an intense structural transition. And for a lot of these companies, technology isn't just a nice to have for growth, it's become a straight up survival mechanism. So, in this intelligence briefing, we're going to break down 5 key areas. First, we'll look at the immense pressure the market is under. Then we'll explore how AI has really moved from a theoretical idea into day-to-day practice. We'll cover robotics at every scale, from the macro to the nano. Then we'll analyze Big Pharma's big AI gamble, and finally, we'll wrap up with the investment outlook for 2026. Okay, first up, the market. It is weathering an absolute perfect storm of external forces right now. And this isn't just one single headwind, it's a convergence of patents, politics, and pricing that is fundamentally changing the entire industry. The first shockwave hitting the system is what's being called the patent supercliff. We're talking about hundreds of billions of dollars in reliable, established revenue that is now at risk as these legacy blockbuster drugs lose their patent protection between now and 2030. For investors, for executives, this is nothing short of an existential threat to the current business model. And if that wasn't enough, we have some acute geopolitical pressure. Just in early April, the Trump administration slapped a staggering 100% tariff on pharmaceutical products and ingredients. That was then paired with a most favored nation executive order, which basically demands that U.S. drug prices have to match the lowest prices in foreign markets. This has sent companies absolutely scrambling to restructure their entire global revenue models. So how is the industry responding to all these threats? Well, with capital. A lot of capital. Large pharma companies are sitting on an estimated $2.1 trillion in available cash, and they are deploying it aggressively to buy their future. And this isn't just random spending, it's flowing directly into what they see as their number one line of defense: artificial intelligence. And that brings us perfectly to our second section. AI in healthcare has officially left what I like to call the honeymoon phase. It's no longer just a cool concept for research papers. It's become a core operational necessity for both survival and growth. Now, the really critical piece of technology driving this shift is something called large action models, or LAMs, and this is a hugely important evolution from the large language models we've all gotten used to. LAMs are what we call agentic AI. They don't just generate text, they're built to actually take action and autonomously execute complex workflows. They do things. And this comparison just illustrates the difference perfectly. So, while an LLM might help a doctor synthesize some information or draft a report, a LAM can actually log into the electronic health record system, retrieve lab data, and integrate it, all without a human touching the keyboard. It's that massive leap from assisted intelligence to true operational autonomy. Let's make this really tangible. You could task a LAM to draft a clinical study report. On its own, it will access the EHR, pull the necessary lab data, cross-reference everything with a quality management system, and then draft the report. This isn't science fiction, folks. It's happening right now. And the projections are that this can free up anywhere from 25 to 40% of an organization's entire capacity. That's a game changer. And of course, the market is validating this trend with serious capital. RingCentral has launched an agentic AI just for patient communications. Unity AI just raised $15 million to build out an autonomous healthcare workforce. Translucent raised $27 million to automate revenue cycle management. The investment thesis couldn't be clearer. Autonomy is the future of healthcare operations. Okay, so alongside all this digital automation, we have physical automation that's transforming healthcare at literally every conceivable scale. From the hospital hallways all the way down into the human bloodstream, robotics is absolutely here. We've seen a huge surge in FDA clearances for surgical robots just in the last few weeks. Stereotaxis is digitizing catheter labs. Revolve Surgical is coming in to lower the cost barrier with reusable arms. And of course, you've got the giants like Stryker and Medtronic expanding their robotic footprints. For investors, this signals a massive opportunity in medtech innovation. But this brings up a really critical question, especially for any hospital administrators watching this. We all know hospital margins are already compressed, so thin. How can these facilities possibly afford this new wave of advanced robotics? Well, the answer is actually coming from a fascinating new solution: remanufacturing. A company called Restore Robotics just got FDA clearance to remanufacture instruments for the Da Vinci surgical systems. This creates a high-quality but much more cost-effective alternative to buying brand new, which directly addresses that affordability crisis and, in the process, opens up an entirely new market subsector. And if we look to the absolute frontier of this field, we have DNA robotics. Scientists are literally creating programmable nanomachines using DNA folding techniques. You can think of them as nano-surgeons that can be guided through your bloodstream to deliver drugs right to cancer cells. This isn't just about automating surgery anymore. This is about automating therapeutic delivery at the molecular level. It's incredible. Okay, now let's pivot and look at how the industry's largest players are strategically deploying AI and that massive war chest of capital we talked about to defend their market leadership from all these pressures. Now, this slide is absolutely packed with high-value intelligence, especially for the investor audience. You can clearly see the dominant strategies taking shape. You've got Eli Lilly with a market cap closing in on $1 trillion, betting big on oral GLP-1s and a huge AI discovery lab with NVIDIA. You've got Johnson & Johnson pushing for $100 billion in revenue through oncology and enterprise-wide AI. The common thread for every single one of these leaders is a deep strategic integration of technology. And really, nothing drives home the real-world financial impact more than this quote. Pfizer's CEO directly credited the company's deployment of AI as the primary lever, not a lever, the primary lever, for slashing billions in R&D and administrative costs. This confirms that AI isn't just about finding new drugs, it's a critical tool for profound bottom-line efficiency. And finally, let's follow the money. This section is all about actionable intelligence. We're going to look at where venture capital is placing its biggest bets in this current environment. This chart tells a really powerful story. Of the $23 billion raised by U.S. healthcare startups over the last year, nearly a third of it, the biggest slice by far, flowed directly to AI-driven firms. That is the single largest category, and it signals overwhelming investor confidence that AI is the dominant force shaping the future of this industry. And you can see this thesis playing out in very specific deals. Capital is flowing into clinical autonomy, with companies like Doctronic creating an AI physician that can autonomously refill prescriptions. It's flowing into enterprise infrastructure, like Verily's massive $300 million round to scale its precision health platforms. And it's flowing into the core platform technologies that are going to discover the next generation of therapies. Which leaves us with a final, and I think, very provocative thought. In an industry that's being redefined by patent cliffs and immense political pressure, the old moats, things like brand and scale, they're eroding. The question for every single investor, executive, and provider in 2026 is this: is technological agility now the only truly defensible moat left?